Yeah, this graduating class, we've had people in neurosurgery, vascular surgery, anesthesia, ENT, ER, peds, so pretty much everything. I would say we might even have less primary care, a lot of OBGYN. But yeah, there's some pretty competitive specialties that you wouldn't really think of being as into public health. But I know there's people, we had a talk a few weeks ago about like what they use their MPH for on like the interview trails. And a lot of it was like an unexpected way of kind of melding all of their passions together. And also something that when you're on these interviews, like you can't be the best at, plastic surgery and like, wow, the attendings was they're, much more years of experience, but you can give them a different perspective on public health and something that they might not have thought as much about because, once you have this, you are an expert in public health. And there's a lot of things that you might have to say that are original opinions that can be really useful to you later on.
I'll give an example, like, because like one of my interests is dermatology, even unfortunately for me. But yeah, so one of the research projects I'm kind of doing to like integrate public health and skin conditions is there's an underrepresentation of brown and black people when looking at how different skin diseases show up on their skin. So oftentimes certain conditions are missed or they're not recognized. So it's how can we really like spread more information about how different diseases and disorders look like on different skin to current practicing physicians and integrating it into the education of medical students so that there's not sort of like this one mental picture of what something looks like and things like that. So that's one of the things I'm working on, and that's a way to kind of integrate it as well. Another thing is that a lot of patients who really need like care when it comes to dermatology don't receive it because of the copays, because a lot of the medications don't fall under insurance plans. So how do we get these patients care for things that they really need when they're usually not covered at the same level as other specialties and other medications? So it's looking at how to maybe balance that out. So it's really, you can apply public health to like anything you're interested in, because in the beginning even I was wondering, I was like, how am I going to integrate these two things that seem like two separate interests, but there's always a way to do it. You just kind of have to get creative and see what you care about, and then building from there. Like once you realize what you care about, what you're interested in, you can make almost anything relate to public health if you think hard enough.
I don't know if Justin, if you have anything more to say on that one.
Yeah, I was going to say I applied peds, but I have no interest, not no interest, but no plan of general pediatrics practice. My plan is definitely pediatric critical care, which is a pretty niche field, and on some level, like tertiary quaternary care, like almost feels like the opposite of public health, and have definitely gotten asked questions about that one. But kind of integrating that health system side, a big issue is most kids, when they have critical illness or injury, they're not presenting at a pediatric hospital that has those resources available. So in my mind, kind of the caring for those critically ill kids needs to extend beyond just the people in the ICU and really integrate into the question of how do we work with EMS partners? How do we work with the transport teams? How do we work with those outside community facilities to find out, A, how can we support those providers in caring for those kids really early on in their course of illness? But also to that same end, think about, are there ones where we can remotely support them using telehealth and prevent the kid from having to make that transport, because that's expensive. It means a family is relocating for the course of that illness. And there are opportunities in even some specialties where you're like, what is the connection? Some of my good friends are doing ENT, and ENT really needs a lot of screening services. We're seeing more and more HPV related head and neck cancers. And the screening tools just don't exist the way that they do for things like pap smears or even anal cancer screening, which are also caused by HPV. So that's a huge one that she is really passionate about, and kind of brought that to the interview trail. And was incredibly well received. And another one of my HPSM cohort is plastic surgery. Plastic surgery is, full of questions about health policy and insurance and a lot of reconstructive surgeries. There's questions about coverage or whether or not it's really medically necessary. But I think most people would agree if you remove something, it's the courtesy move to put that back as best you can or reconstruct. And also another one that I'm really passionate about from the ped side is issues of gender affirming surgical care, and how do we think about that one and integrate that into both, unfortunately at this point, legislation to protect the ability for people to get that one, but hopefully, barring that issue, the access and payment, and making sure that those are things. So there's a lot of ways that you can connect topics to public health, and really it comes down to questions of paying and how do we make it work, and really just having that skill set to look at things, like from a system standpoint, understanding, kind of how that sausage is made, not just how all the specialties are done. You can come in and look at a problem that other people might be facing and bang your head and go, oh, what if we did this? Because we have a different set of experiences and tool sets and perspective. And I think, no residency that I've talked to was like, oh, that was a waste of time. I think everyone really looked very favorably upon that one, and it really gave me, I think, a competitive advantage that helped me throughout medical school, but also getting into a good residency, and I'm sure is going to translate into ample opportunities throughout my career.
Thank you.
Well, thank you all so much for those great answers. I think that we kind of heard those same sentiments from every one of our graduating MD and PH students that, that did match in these specialty fields, is that just getting the MPH alone just makes you more aware of the issues that are present within healthcare and within each of one of those specialties as well. So that when you get to the residency interview and they're asking you these questions, you're able to speak on it confidently and knowledgeably. So there's so many things that it really helps that you may not even realize. Previously last year, we had a student graduating in radiology, and they were just happy to have someone that had experience giving oral presentations and that was able to have those soft skills as well, because during her MPH, she was able to give lots of presentations and develop lots of posters and things of that nature. So I think that there's so many ways that the MPH aids you. It just kind of determines how you would like to leverage it during your interview process. Does anyone else have any questions, or do any of our current students have anything else to add before we wrap up for the evening?
I have one question that I think kind of probably no one would ask because you're all too polite, but I think is one that's worth exploring. Of the question of, if you are choosing to add this degree, why would you want to choose LSU versus, once you're in med school, you would have your choice of MPH programs. You could take a fifth year like I did. You could go to Harvard, you could go to Berkeley, you could go to the top name public health schools in the country. And some people would say, well, why not do it that way? But I think there's a lot of value to doing it at LSU for three major reasons. I think one of the first and foremost is cost. You can't beat this from a value standpoint, especially if you're in state. It's like you're basically getting the degree for free. And I think that's really important to think about, because as we talk about public health all the time, cost, value, quality is always super important. I think the other thing that's really important too is the size of this program. It's small enough that you're going to have outstanding relationships with faculty, and they're really going to get to know you. And you can't say the same thing at some of these bigger programs that may have, that name recognition, but you're not going to develop the relationships and the mentorship, which I think is really important in terms of thinking about what's going to help you be successful in medical school, but also beyond. Because I know Tim and Nicole both got letters from public health people as well. And those are letters from people that know you longitudinally. I mean, they knew me for a couple of years. They'd known them for like 4 years. And these were letters that were called out by people that were interviewing me of, wow, like this person not only really likes you, but like really knows you. And that comes across in the letter that they write. And I think that's invaluable as well, because everyone is going to have great test scores, great grades, MPH from a great program. A thing that can really LSU can do to help set apart is you're going to have that relationship where it's a meaningful letter from somebody that actually knows you. And I think that third piece is that the opportunity, the things that people are talking about from a research standpoint. I didn't start out in the so intimately involved with the public health stuff, and I can tell you, you don't get the same number of opportunities thrown at you outside of the public health. But when you're in this kind of small club, there are public health, great research happening at LSU from the public health faculty, and they're always looking for help. And people are always going to look to people that they know and people that they're around. And you're just around so much great research between the Louisiana Tumor Registry, so many other programs that are housed in this School of Public Health, where they're looking for eager, motivated people. And you're going to have to dodge research. You're not going to have to go find it if you're in this program. So I think from the cost standpoint, the personal relationships and the opportunities that get thrown at you, like you couldn't beat the program as a like overall anywhere else. And if you're coming here for med school, I think it's the best choice that you could make where to get your MPH degree.
Thank you, Justin. That was lovely. Thank you.
Number
all.
4 is Aisha. She's like the most supportive person ever, and we like all call her when things aren't going well. And even if it's like not public health life issues, you're like way better off.
Thank you. Thank you. And I am always here too. If anyone has any questions about the program at all, I am here to serve. So I'm happy if everyone knows this, Sam knows this too. Call, text me, email me if you have any questions whatsoever. I am ready and available to speak with you, to work with you to develop a program that will help to meet your needs and works on a timeline best for you. So do not hesitate to reach out to me if you have any questions whatsoever. But if we don't have any more questions today, just want to thank all of our new hopeful students for joining us today and all of our current students for giving us their perspective. We really enjoyed hearing about your experiences and the value you find in this program. And to our 4th years, best of luck. I hope we stay in touch. I'll miss you guys. But if you don't have any other questions or anything else, thank you all so much. And I hope to hear from you all soon.